Welcome to Wellness Decoded, the podcast where we cut through the noise, debunk the myths, and uncover the truths behind all things health and wellness. With so much information coming at us from so many sources, it's more important than ever to make decisions rooted in facts and backed by science. Together, we will explore the latest research, break down complex hot topics, and give you the tools to become the CEO of your own health. I'm Cecily Crable, and I'm here to help you take charge of your wellness journey, one decoded truth at a time. Let's dive in.
Today, I am thrilled to welcome Jennifer Killebrew from Glow Med Spa, a pioneer in aesthetics and wellness, to take a deep dive into one of the most talked about topics in weight loss and longevity today, GLP-1 medications. Jennifer has a Jennifer has a doctorate degree in nursing and is an advanced practice registered nurse. She has been a professor in the graduate and undergraduate nursing programs at the University of Texas, Texas Tech Health Science Center, go Red Raiders, and Texas State and Austin Community College. Education is an extremely important part of her 16-year nursing career. Informing patients on safety, product information, and about post-procedure care is paramount. She is a published author and has been a project lead on numerous quality and safety initiatives and is active in research. Welcome, Jennifer. It's nice to have you today.
Thank you. That's very kind. All of that is very kind.
Well, I wanted to start out today just by, can you tell us a little bit about your background and kind of what led you to aesthetics and starting Glow Med Spa?
Oh, yeah, absolutely. So I started as a neonatal nurse. Prior to that, I actually graduated from the University of Texas, Austin with anthropology and realized quite quickly that nursing was where I wanted to be. So kind of went the long way, did a RN, then BSN, and then got my master's in neonatal nurse practitioning, and then ended up getting my doctorate. And then, I started doing aesthetics probably 14 years ago myself, and I saw that there was a gap. I felt like aesthetics was too overdone, and I just didn't like that. I liked that we could use aesthetics for just to enhance your own natural beauty. So that's really why I got into it. I probably studied it for, my goodness, 10 years before I actually opened Glow and got certifications and had a bunch of willing participants to kind of help me and good mentors. So that's kind of, we started Glow and I think our first patient walked through the door in August of 2020. So
right in the middle of a pandemic.
Yeah, right in the middle of a pandemic. Yeah,
brave. Being a business right then, right? Can you tell us a little bit about the services you offer at Glow Med Spa?
Sure. So we started with, of course, the bread and butter, which is Botox, fillers. We have microneedling, and then expanded our services to hydrofacial, and we do have a CO2 laser now that we use, and Sculptra, which Sculptra pairs really well with GLP-1's. And we also do weight loss. So we started semaglutide and it'll be 2 years in March when we saw that, there was a need in the market to help people lose weight that, modern medicine really wasn't able to help the client. So, yeah.
Awesome.
And how we got started.
Well, let's dive in a little bit to GLP-1s. Can you explain to our audience what a GLP-1 is and how they work?
Sure. So it kind of depends on which one you're talking about. Semaglutide will be your second generation of a GLP-1, and tirzepatide will be the third generation of a GLP-1. There are other GLP-1s. These just happen to be the ones that are the most effective in weight loss. So Ozempic, you probably have seen that commercial long ago. We can't really talk about it as a brand, but Ozempic is kind of one of those first GLP-1s, and they studied it, and it's for diabetic patients, and then they realized, oh my goodness, like they're losing 15% of their body weight. So then they went back and got approval for weight loss, and that will be Wegovy. And then tirzepatide came out, and that's what you hear about Mounjaro and Zepbound. Now, we offer compound medications, so it's patient-specific. We do have office-specific ones as well, but they are made a little bit differently than the brand name ones. So,
now, correct me if I'm wrong here, but the body creates a GLP-1 itself, correct?
That is correct. Yeah.
And so my understanding is these peptides are the way I kind of think about it is almost like a little bit like hormone replacement therapy, in that it's replacing something that you're no longer producing very well or at all, maybe.
And that's a brilliant way of thinking about that. Absolutely. Yeah. So, we all have our own GLP-1 in our bodies in certain levels. And if you give someone a GLP-1, you can mimic that effect. And a lot of people need it, and that's where you kind of determine the dosing. So how much natural GLP-1 do you have in your body? So.
Okay. Awesome. And why have these medications become such a game changer in the weight loss space?
Oh, accessibility.
Yeah.
So a lot of family physicians don't want to prescribe it because insurance won't cover it. And a lot of insurance don't cover weight loss, unfortunately, because they don't look at the long-term benefits of health. And part of that is because people bounce between healthcare plans. And so they're really looking at where can they make their most money quickly. So that's where compound pharmacies stepped in and said, we can help. And there's a shortage of these medications. And that's where that's really why they became so popular, because we're able to get it out to the mass groups of people because there's been shortages with the brand names.
Okay.
Yeah.
Interesting. Mm-hmm. Interesting. And what are some potential risk and side effects of the GLP-1s? I know we hear a lot. So I feel like on social media and in the news and everywhere else right now, there is two camps, right? Mm-hmm. There's this camp that, oh my gosh, this is the greatest thing since sliced bread. And then there's this camp that's like, oh, it's going to cause cancer. You're going to lose all your muscle. It's horrible. Stay away from it.
Yeah.
There's always a middle ground, right?
Totally.
What does this middle ground look like, and what are the side effects, or what are benefits and the side effects?
So, I mean, there are people that you just absolutely can't give it to. Thyroid medullary cancer, you can't give that to them. It has been kind of known to produce that in rats in high volumes. So you have to be careful with that. Not all cancer, not thyroid cancers, not all of it, but you have to get cleared from oncologists for that. But pancreatitis is one. Gallstones is actually one that I've seen even in practice. But it's usually people who are kind of getting the gallstones already. But it's pretty rare. I mean, I'm seeing about 2% of our population getting gallstones. So very small. The pancreatitis, I had not seen one out of about 900 clients.
Oh, that's great.
So yeah.
But
so there is a risk.
The risk is there, but it's low.
It's very, very low.
Okay.
Absolutely. Okay. Yeah.
And then what are some of the benefits that you've seen with this medication, even just outside of weight loss?
What I find is that weight gain is such a mental game.
Sure, absolutely.
And people try so often to lose the weight, and the consistency is difficult, and the messages are confusing. The messages, don't eat, don't eat, don't eat. So then they starve themselves and wreck their metabolism along the way. And the benefits are really, I'm sorry, was that the question?
Yes.
Okay. Yeah. The benefits are that I look at it from the top. We're affecting mental health in these clients so much so that they feel more motivated to lose the weight, to do the things that they need to do. The food noise is gone. So a lot of people will tell me like they're constantly hungry. And that's a horrible feeling. Constantly hungry. It causes a lot of anxiety. So if we can quiet down that constant noise, and it's very effective at that, then people feel like they can do better throughout the day. It also helps you eat about 1/3 to 1/2 of the calories that you would normally eat. I mean, we're Americans. Portion control is a huge problem.
For sure.
Yeah. So those are the major side effects. So the major benefits. Whereas side effects are nausea, constipation, headache, tiredness. We are finding that it affects the reward center in the brain. So if you put too high of a dose with somebody, you can actually make them not want to eat, not want to work out, not want to cook, not want to have sex. So it can actually affect that part of the brain. So, but that's a lot because people think that dose equals weight loss, and it does not. People have to remember that we have GLP-1 in our body already. Dose equals symptoms. So once you find your perfect dose, you should back off, and that's where you belong. So
Yeah, and that's important to know.
Totally important to know. It's actually something we've kind of learned along the way. I mean, we definitely are learning more because so many more people are on the medications, and we serve a very big population of people on these medications. So we learn a lot about what works, and we stay up to date on the research of how these drugs work and how it's improving cardiovascular health. I mean, they're putting out studies on that right now. That's huge.
Yes.
Alzheimer's, because Alzheimer's is essentially diabetes 3. If we can keep the blood sugars low, we can affect these long-term complications with people. So it's pretty cool. It's a pretty cool drug.
Right.
Yeah.
Is there, and I'd heard recently that there is some emerging research or some theory that it's even really has a really beneficial effect on inflammation.
Oh, absolutely. Tirzepatide. So tirzepatide lowers the CRP levels, is what they're finding. And CRP is that marker for inflammation. So it's that, you have the ESR, which is a long-term marker for inflammation, and CRP, which is kind of that short-term marker for inflammation. So it's lowering the inflammation markers in the body, which is absolutely incredible because heart disease, diabetes, obesity, I mean, inflammation is the root of all of these.
Absolutely.
So it does actually have that added benefit. I think they're going to keep learning more and more about that part of it. But yeah, the evidence is there.
Yeah, that's incredible. I love hearing that just because from my own perspectives, struggling with rheumatoid arthritis for as long as I have, inflammation's a huge issue for me. Absolutely. So just knowing that there is emerging research of something that's naturally made in your body, that if you can replace it to some extent and help reduce that inflammation, that's incredible news for people like me.
Yeah, I mean, it's one of those side effects that we have definitely seen anecdotally at Glow, and even at Hutto Weight Loss and Med Spa as well. That people are just like, I just feel better. I'm not as inflamed. I don't retain as much water. So it's been an interesting thing to watch with people.
Well, and I think that's the other thing is I think inflammation's tricky. Mm-hmm. I don't think people don't realize they're even inflamed or that they have inflammation until it's gone. Mm. And then they're so overwhelmed with how good they feel. And they're Absolutely. Like, whoa. I mean, I have that with even some of my faster weight clients in that the minute we just switch them to whole foods and they're not eating as much processed crap, the inflammation goes down immediately. And they're just like, I already feel better and I'm only a week in. Yeah. And they're like, but I haven't lost weight. I'm like, because this isn't about weight loss. That was inflammation. Right. Like, I just lost a bunch of inflammation. Yeah.
Like,
but
food is medicine. So I think people forget that. Absolutely. And that's something you're definitely doing with faster weight. Food is medicine.
Yes. Yes. And to that point, so when you have a client that you're working or a patient that you're working with that you're prescribing a GLP-1 to, what types of what are you implementing with them to make sure they're using it safely, one, and that they're doing it the right way? Because I do believe, too, just seeing it across the board in many different medical clinics, that it can be done a wrong way and it can be done a right way.
Oh, yeah, absolutely. And, in clinics like med spas, we use medical directors. So we have standard protocols for all of that. And we follow those guidelines and protocols. And so when a GLP-1 is prescribed for a patient, our protocol is to start at the bottom. So the very lowest dose and titrate up, because there's a percentage of people at that very lowest dose that they have major side effects. And I see people wanting to go fast and furious, and what's the point? You don't lose any more weight. You're just more sick, and you ruin your metabolism, and you cause more inflammation and wreck your hormones. So that's kind of how we see them back in 4 weeks, and we determine what are their side effects, what's their appetite like, is the food noise gone, are you able to eat enough to maintain your metabolism? When people come in and they say, I can't eat, that's a red flag.
Right.
So we are huge. We preach on protein. Any of my clients watching this, they're so sick of me say protein. You got to eat, and you got to eat protein. And that's the key to weight loss. Protein equals weight loss. So yeah, and muscle equals metabolism. And those are things that we preach over and over and over. So when people are doing it wrong, it's often that the doses are way too high. And letting your clients dictate what that dose should be because they want it faster, right? They want more and they're spending the money. Well, too bad. You need to be doing things healthy.
Well, you've got to do it a safe way. And two, I think, there's got to be some lifestyle changes, right? I had a friend of mine actually who went down the GLP-1 route for a little bit, and she was so frustrated because she didn't lose any weight. It just didn't work for her. But she did not change her diet at all. She did not work out.
Yeah.
And I even tried to tell her as a loving friend, like if you don't do the small, because the other piece of this is, and we could get down a rabbit hole on this, but is insulin resistance, right? And if you've got some insulin resistance that you're not correcting, the GLP-1's not going to be as effective. Am I correct on that?
It should, but it takes longer. It could take 3 months for them to kind of start losing, because you're kind of lowering the blood sugar, you're affecting the pancreas, the liver, and how that metabolism all works. So if all that metabolism is wrecked, we got to fix it first. So, and visceral fat, I mean, the GLP-1s go after all of that. It's working. It's just working not how they want it to. And in the meantime, they're not eating enough. Their hormones are a wreck again. So it's a big picture. There are some non-responders. I will say that. I think I'm seeing about 2% that just will not respond.
Interesting.
Now, I can most often trace it back to lifestyle.
Okay.
And protein intake, to be honest. But there's still some that we try, and it's just, they don't respond. So like any drug, some people aren't going to respond. And from what we're seeing, it could be upwards of 2%.
Okay.
So,
which is still a pretty small number, though, totally, when you think about it.
Yeah. And, often those people that don't respond, we'll be like, well, get off of it. Then you're not responding.
Right.
I tend to see them back because they realize that it was helping them. And then they're realizing that they weren't putting all the pieces together. But I do agree there probably are some real non-responders out there.
Okay.
Yeah.
Yeah.
It's pretty small.
And that could be for me, I'm like, well, if you're working on getting healthy by doing this, why wouldn't you take it even a step further and just change the diet? Or, well, okay, let me ask you this. How important, because the other thing we're hearing a lot of is it's very important to strength train or do resistance training when you are taking a GLP-1. Can you explain why that's said so often?
So I think that's a little messy because if you're on a low-calorie diet, you can lose muscle anyway. Excuse me. If you're very overweight, it's acceptable to lose about 10% of your muscle mass. If you're 250 pounds and you need to lose muscle mass because you're going to walk around looking like a bodybuilder to support your skeletal muscle. So some people just naturally with weight loss will lose muscle, but then you're talking about Ozempic face, Ozempic butt. They're real. I've seen it. And a lot of it's because they're not doing it right. They'll say they are, and it's very evident that they're not. So you do have to be strength training. You have to eat. Do not use this as an anorexic. You're going to be skinny fat.
Yeah. Which is just as unhealthy as being overweight.
Absolutely. Yeah. It leaches all the minerals out of your bones. You lose your hair. Your skin is a wreck. None of that works.
Yeah.
It doesn't work. So, yeah.
And just like you were saying earlier, you mentioned visceral fat, and I think this is important for our listeners to understand. Can you explain what visceral fat is?
Ooh, the unhealthy fat that sits all around your organs. So it takes time. Actually, visceral fat is not heavy. It doesn't weigh a lot, believe it or not. It can be 2 pounds of visceral fat's a lot of fat. So think about just 2 pounds around your organs.
Not much.
It's not, but it's very unhealthy. And so we tend to get more visceral fat for women, perimenopause, postmenopause. It tends to just kind of, the hormones put it right there.
Oh, lucky us.
Yeah, lucky us. It's all that hormone stuff. And so the GLP-1s do go after that. So think about long-term health benefits. Visceral fat out, that's huge, because that's heart disease, that's high blood pressure, that's all the inflammatory processes that we're talking about.
Yeah.
Some people who very clearly, when you see them, have a lot of visceral fat, they don't lose weight right away. I do see that. Like, they start shrinking inches before the weight loss starts to come off. And I always ask, like, are you losing inches? Yeah, my pants are fitting, my clothes are fitting. Well, you got a lot of visceral fat going on. And so it kind of goes and gets that first, and then they start kind of shedding weight.
Which is interesting.
Mm-hmm.
Yeah. Which really, like you were saying, though, visceral fat is the dangerous fat. So that's something that I mean, listen, if a GLP-1 goes after visceral fat, that right there is a win for me.
Yeah.
Because long term, that is going to prevent chronic illness for you.
100%.
Ultimately.
Yeah.
Um,
Known fact.
yeah. Yeah. So, I mean, it's
Known,
just,
well-studied
and
fact.
I don't think we talk enough about visceral fat. It's so crazy to me. People always talk about muscle and body fat, but we rarely talk about visceral fat.
Yeah.
And how would one go and find out what their visceral fat is?
Oh, you can do a DEXA scan. There's quite a few around town. I do mine at Live Lean RX out in Westlake. It's like $75. And it's good if you're going to start a GLP-1. It's good to get on to do a DEXA scan and maybe do one 3 months, 6 months, and see where you're at.
Sure.
To make sure you're not losing muscle.
Right.
So if you're eating, 90 plus 90 plus grams of protein, and you're doing the heavy weight training, you're much less likely to lose the muscle. But if you're starving yourself, your body's going to eat your muscle anyway.
Absolutely. No matter what, whether you're on a GLP-1 or not.
What? Yeah. So that's the kind of muffling of the losing the muscle. Well, what are you doing wrong? And what should you be improving upon to keep the muscle?
And like you
Because
said,
both things are possible.
yeah.
So
And like you said, protein. I mean, it is even whether you're on a GLP-1 or you're not on a GLP-1, protein should be a priority for everyone, especially as women as we age.
Yep.
Because have you read Dr. Gabrielle Lyon's book? Oh my goodness, now I'm not going to remember the name of it, of course. But anyway, phenomenal book. And she talks about how the muscle is the organ of longevity.
Oh, totally.
And I encourage everybody to go out there and read that book. I will try to figure out what it's called and put it in the caption. But
Well, that's our structure.
Yeah.
So it supports our bones. As you get older, you need that bone support. Watch the blue zones. That'll change your mind.
absolutely. Yeah, that's a great one.
Yeah.
And it also helps your metabolism, like you were saying.
Absolutely.
So,
The key to keeping muscle as well, stop making your doses so high. Be honest with your practitioner about it. When you have the support that you need with the diet and not eating as much, stop at that dose because you need the protein in order to gain the muscle. So I do there's another weird thing that happens. I have had trainers that come in, they cannot lose the fat off their body. It is the most interesting thing. And one thing that I find is they're doing too much.
Yep.
They're not eating enough to balance this crazy caloric output that they have from working out. And again, they're putting their body into starvation mode.
Yeah.
So there's all sorts of interesting groups of people that behave differently. So, and we work with them all. I mean, we have to pull people out of their thought processes.
Absolutely.
And be like, listen, look, here's what's happening.
Well, we all grew up in a diet culture, right? Where it
Yeah.
was don't eat more than 1,200 calories and go spend at least an hour on the elliptical, and then you can be skinny, right?
No.
And we now know that what did that do to us? It destroyed our thyroids. It destroyed our hormones. It destroyed our metabolisms. We now are learning that was such a bad way.
Well, you taught your body you don't need calories.
We're now.
So
And it goes into starvation mode. And ultimately what it does is it holds on to that fat.
Yep.
I mean, like I tell my clients, it's a very intuitive thing that the body does, right? So that if we're ever in the event that we are starving, if we are in a desert and we're stranded for weeks on end, we will survive, right? Because we have that stored fat. Your body knows what to do to keep you alive.
Yeah.
But we live in America. We are not starving.
No.
So we can afford.
Some people strangely are, but in a weird way.
Well, that's true too.
Yeah. I hear what you're saying, portion control and all of that, but then we have that other subset that especially my postmenopausal women, they have definitely been preached to you don't eat, you lose weight.
Yeah.
Not true.
Not true at all.
So we are restarting metabolisms on them. It's tough and they're very frustrated. So I think it goes both ways. There's just been a lot of misinformation. That is one thing that the GLP-1s I think are bringing to the forefront.
Yes.
Metabolisms and how important they are. And I tell everyone to get Metabolism Makeover by Megan Hansen.
Oh, that's a good
because she teaches intuitive eating. And my clients are like, I'm hungry. I'm like, okay, good. You should be hungry. You're a human being. But are you eating half to a third of that? Oh, well, yeah. Okay, great. So now we're there. Yeah. I want you hungry. Yeah. I want you to be a metabolism burning machine. And like your faster way really helps them get on track with that too. Like it helps them learn that concept.
And let me ask you this. So you mentioned earlier how it works. It kind of turns off the food noise in someone's head. And I know a lot of times, especially I see it all the time with clients, where when we really start diving through, when are you really hungry and why are you really eating, right? Do you feel like that would, if we can turn off that food noise, then maybe we can dive a little deeper and go, okay, am I eating because I know I eat more when I'm tired. It's a given. Like I know, like if I'm like really hungry today,
cortisol.
I sit and really think about it and I'm like, oh, I didn't sleep great last night, or I am stressed out, right? And so I know, but that's intuitive, right? Like I know, okay, wait a minute. Why am I really wanting food right now? Am I really, really, truly hungry? Do you think that totally plays in with the GLP-1, and when it turns off the food noise, you're able to decipher more?
That depends, because it can go the other way as well.
Okay.
Because when people don't eat, the cortisol levels go up in their body. Blood sugars go up in their body. They don't sleep as well. And then kind of like you're talking, I didn't eat, I didn't sleep. So now you're hungry for bad food.
Right.
So you have to be careful on the GLP-1s, because if they don't want to eat, we can get into this other phase of, well, now we're having high cortisol, and now we're starving, and now we're tired, and now we want sugar. So it does take some monitoring to kind of help people figure that part out. As far as when people are hungry, like they're missing something, you know. You're hungry because you need food. You're starving at dinner because you didn't do well with your macros throughout the day. You didn't get balanced food. The body wants what the body wants to operate, and it's going to get it. And sometimes it's in that fast form of bad fats and bad sugars. But you know what I tell people? You're craving sugar, eat a fourth of an avocado. I bet it goes away.
Absolutely. Yeah. Isn't that crazy? Mm-hmm. So that's another thing I always tell my clients is I'm like, so processed foods, right, are so void of the nutrients that your body is craving. So that's why when you eat processed food, you're still hungry and you keep eating, and we overeat.
Yeah.
Because what your body's saying is, yes, I need more because I'm not getting the nutrients I need to function appropriately.
Totally. On the elevated sugars in those foods, and just to keep it sweet. And so your pancreas is a wreck. So, I mean, you teach your body to work on that amount of sugar as well.
Absolutely. Absolutely. So when a client comes in to see you for a GLP-1, what's kind of your protocol to get started? And then what does that look like in your program? Like, do you require certain things of them, some non-negotiables or anything that you require to keep going and keep giving them the GLP-1, or what does that look like?
Yeah, so when they first come in, they have to get approved. Obviously, fill out paperwork. You know, we have to make sure they don't have any contraindications for the medications. Have to be approved by advanced practice nurse or physician or PA. And then we look at everything. I'll tell you, everyone starts at the lowest dose, so that's pretty simple. We have a protocol. We can veer from the protocol, and once we find their dose, we're done going up. So they come in once a month, and we talk about that. Once they're kind of established on a dose, like we'll let them go 3 months without that kind of extended visit. But we love to see people like pretty extensively for the first 3 months to kind of figure out what dose do you need, how's it going, are you eating, are you getting the protein, which is usually no. And we'll say, if people aren't tracking protein, they're not getting enough. They'll say, I'm getting enough protein. I'll say, well, tell me what you are doing. What would you eat yesterday? And I'm like, you got 50 grams of protein, so you're 50 off. And they're like, what? So definitely we preach nutrition. Absolutely. And that's a big part of our education. So we're doing a lot of educating.
That's great.
You know, we have the protocols, we have the history, we have the approvals. We have a lot of education that's really going on because people don't understand nutrition.
They don't.
They don't understand macros. They're like, well, how much protein is in chicken? And I'm like, well, how much are you eating? And, you know, I know macros pretty well, you know, not as well as you do. And
I don't know about that. You probably do.
I mean, it becomes daunting to teach someone about macros. So I think they should teach it in school.
Absolutely.
Yeah.
Well, yes, especially med school, right?
They don't.
And nursing school. They should start teaching it there.
Nutrition, they do in nursing
A
school.
little bit, but not near to the extent we probably should have it.
And they don't I don't know what they do now, but historically.
They have not.
Yeah, historically.
I think most physicians would say that too. They'll be like, hey, there's not a clue when it comes to
100%. Absolutely.
Yeah, so with the protein thing, I think that's everybody. I don't think anybody, unless you're tracking, knows how much protein you're getting, and I think you're even shocked. My husband, for instance, who is, by the way, a 6'4", in shape guy, always has been.
Yep.
I got him involved in my program just because he's impressed with the science behind it and the strategies and for your overall health. He by no means needs to lose weight. In fact, he wants to put some on. But anyway, so I had him tracking for the first time. And he was blown away with how little of protein he was eating. Like, he thought he was eating all this protein. I did too. He eats a ton.
Yeah.
The guy eats. But for his body size and what he's
probably
willing to do.
200 grams? Yeah, that's a lot.
And he's like, I'm not at my protein yet. I'm not at my protein yet. I'm like, I told you. It's a lot more than you think it is, but I promise you, it is so worth it.
You feel better.
Absolutely.
I mean, days that I'm like feeling kind of sluggish and I didn't sleep a lot last night, but today doesn't. Usually I do. Usually I'm good, but protein's a big part. I'll go back and say, what have I eaten for protein? I'm like, oops, and go back and do that. So yeah,
it's hard.
I will give a plug for Drip Nutrition though. They had those protein shakes.
Oh yeah, I haven't had one.
Oh,
are they good?
I'm upset. Well, they're kind of dessert-like, to be honest. I had a mango, pineapple, lemon, blueberry one today. But there's really no sugar in them. It's 30 grams of protein. They're delicious.
I'm going to have to check that out.
Yeah. Sometimes I don't like, I know this sounds silly, but I have a sensitive stomach, so I don't always like digesting food. I like to almost give it a break. And so I'll have that, and they use Herbalife protein in there. Yes, like it's super healthy protein with vitamins. So there's your plug, because I love that place.
It's awesome. I'm going to have to go check it out.
Yeah. When I don't feel like, I need a replacement, I'll do that.
That's awesome. That's awesome. So, What are some other emerging, we talked a little bit about inflammation. What are some other emerging things that we're seeing come about with GLP-1 use that would be good for GLP-1 use?
PCOS.
Oh, that's huge.
Yeah. Polycystic ovarian syndrome. My goodness, like practitioners should really think about providing it for them.
That's huge.
PCOS does have an obesity link too. So, but I have PCOS clients who like, oh my gosh, like I don't have that horrible, painful cystic pain this month. They can still feel it, but it's improving. It's been documented to help with PCOS. So that's huge. Other things, cardiovascular benefits, you're going to keep hearing about that. 100%.
And that probably boils down to the inflammation to some extent.
Yeah, absolutely. Well, it also lowers your triglycerides. Yeah. Yes, lowers your triglycerides, lowers your fats in your blood. So, we're going to keep hearing about it. Everyone's probably noticed a huge shift in a lot of people, a lot of like medical professionals, especially endocrinologists. They are all about these.
I love
GLP-1.
Because they weren't at first.
They weren't.
And
they're like one of the first groups being like, yes. Like, we love it. And they're such amazing educators because they're so intelligent and they just know how the endocrine system works and they're seeing the benefits. So I feel like you're going to keep seeing positive shifts in information and more people getting on board.
That's great.
Yeah.
That's great because it seems to have more positives than it does negatives.
Yeah, you have to be careful with some people. Like constipation's a huge problem for semaglutide. If you have IBS-C, the constipation, like you're probably not a candidate for it. Like you'd have to be on a tirzepatide over a semaglutide.
And why is that? What is the difference between the two?
It slows down the GI system. So peristalsis kind of slows down, which is kind of, I feel full a little bit quicker. And constipation is one of those side effects. Like we really have to talk people through. You need water, you need fiber, you need magnesium. And the people that get constipation, it's gnarly. Yeah. So if you're already a constipated individual, you do need to be cautious.
Okay.
100%.
Or get on a soluble fiber for sure.
Yeah. Tirzepatide's probably your better friend in that case. Addiction. It affects the reward center in the brain. I have people that come in, they're like, I don't want alcohol. I can't drink my wine. I've completely quit. That's the high numbers. That's in high numbers that people say that.
Wow.
And so that's a huge benefit. Gambling, addiction, alcoholism. So those are some kind of side things that we're probably going to hear about.
That's great.
It's amazing.
I mean, that would be
Yeah.
incredible if we could help, with addiction.
Absolutely. And I feel like semaglutide has a little bit better effect on
Okay.
that. So when I have people that come in, they're like, I really want to quit drinking, and I heard it helps. I'm like, semaglutide, as long as they meet all the other criteria, that's the drug.
Oh, nice. So you're seeing people, some that are coming to you for it, even outside of weight loss.
Oh, yeah.
Oh, that's incredible.
Yeah. At the PCOS is one.
Which I love that, by the way. And
yeah.
I have such sympathy for PCOS because one, it's autoimmune, so I know exactly how that feels. But then also, I've seen so many women struggle with fertility because of PCOS.
Yeah.
And it's just heartbreaking.
Oh, yeah, be careful. You can get... we actually have heard of like the semaglutide babies.
Oh.
I've seen it actually anecdotally that some women are getting pregnant. So some women that are
you mean
struggling
because they're on semaglutide,
Yeah.
they're able
They-
to get pregnant and they have a baby. Okay.
Yeah.
At first, I was thinking you were thinking like something came out wrong, and I was like, "Wait, a semaglutide baby? What is that?" You had me there for a second. I was like, "Wait a minute,
You
what?"
have to be careful with the semaglutide.
Unless you're wanting to get pregnant.
Yeah, yeah. I've seen it to where
That's incredible, though.
they
That's
can't
good.
get pregnant, and then all of a sudden they're like pregnant, and you're like, oh gosh.
That's great news, though, for people that have PCOS that are
Yeah.
trying to get pregnant.
Totally. I mean, I think you need to be cautious, though, because we're never going to study semaglutide in babies in pregnancy because it's not ethical to do so. So maybe we'll hear, but there have been I haven't heard of babies having complications from moms being on the semaglutide and getting off while they're pregnant. So, but again, if you're trying to get pregnant, be extra cautious. Or not trying to get pregnant, I'd say be extra cautious.
Yeah. I mean, the thought just in my mind, I was like, oh, if I got pregnant right now, it just makes me want to. I know I'm sweating.
I just sweat.
Yeah.
No, thank you.
I'm like, I'm pretty sure I'm
loving my 4 kids. I'm good.
So another question I have, though, is about, so there's a functional medicine doctor that I highly respect and follow, and she talks a lot about how she really encourages, because she does GLP-1s, but she also is very, very well versed in BHRT.
Yeah.
And she talks a lot about how she really would like for her patients to optimize their hormones.
Yeah.
Either while doing GLP-1 or before they take a GLP-1. What's your thought process there?
100%. So statistically, women and men on HRT and GLP-1s do better.
Which makes sense.
So that they actually have a small body of research out there supporting that. So yeah, makes total sense. I will say we're not offering hormones. It's on our horizon for sure.
Nice.
And why? Because we're missing something.
Yeah.
So we have these GLP-1 patients who you're just like racking your brain and you're looking at them going, well, your testosterone's definitely low and you're definitely in perimenopause, so you have a storm of other things going on in there that are really leading to the weight being retained.
Yes.
So I do think they absolutely go hand in hand. I don't think you need to wait to balance the hormones to get the weight off, because you're already balancing hormones when you get rid of the fat.
Sure.
You release the excess hormones. So
It's kind of chicken before the egg.
yeah,
Like,
I mean, to each their own on that, if you ask me. If you're wanting to get the fat off now, I mean, you're going to be more motivated to go to the gym. You're going to feel better about yourself. So, yeah, I agree with that.
absolutely. Absolutely. And so you guys are getting ready to offer BHRT.
We will, yeah. The course that we're doing is extensive. It's 60 hours.
Which is great, because you want somebody that's had an extensive education.
Yeah, and so I finished my family nurse practitioner degree in November. I wanted to add on top of that with the neonatal, so I definitely want to expand my scope of practice. And while I was doing that, I was able to follow some amazing family nurse practitioners and physicians, and I learned a lot about hormone balancing. I get it, and I get the missing piece, and so I really just got to watch some really good practitioners that really prompted my interest in it. So I swear, like the second I graduated, I was like, I mean, this has to be part of our practice.
It's awesome.
So yeah, we're still waiting. The finalization of the family nurse practitioner is still pending. So board of nursing takes a while.
Yeah. Nothing's ever fast.
Never fast. And the DEA. So testosterone.
Which is also never fast unless they're coming after you.
Yeah, no, fair. The DEA, all those things. So we need to wait on those. So we're, doing everything correctly and legally.
Which is great.
Yeah. And we already had, I had the pellet training, and which is great. I was a neonatal nurse practitioner. I can put a needle in just about anything.
The tiniest little
Tiniest little baby. So that was no problem. That was super easy to learn. So yeah, we're really excited, but we're doing it safely and cautiously and making sure that we have all of the legal steps in place and the most education that we can have. But it's a natural. I mean, obviously, I'm 45 years old. I'm experiencing hormonal changes myself. So, yeah, I mean, it's not a matter
part of life.
Totally. It's not a matter of do I have hormonal issues? It's when are you going to get them?
Yes. And it's how bad are the symptoms?
And how bad are the symptoms? Because you don't chase lab, you chase symptoms. So some people go through changes and their symptoms are fine. They're perfectly happy.
Everybody's different.
Everybody's different, but some people really need help.
Yeah.
So 100%, that is on our horizon.
That's exciting.
Yeah, we're super excited. We want to look at the whole person. So
I love that.
We keep moving into that.
Yes, and I think that's so important. I think that is part of what's a little bit broken about our current healthcare system is that we silo everything. And we don't look at a body as a whole, and it is a whole. It is like everything is interconnected. This affects that affects that affects that, but we don't treat it as such.
Totally.
So it makes it very difficult to get to the root cause of things.
I think that's changing.
When
we were in nursing school, things were very much treated as a system and not a whole, which never made sense to me. It's like, I do think medicine's changing. I think nurses are changing, and I think nurse practitioners are kind of some of the people in the forefront, like really being like,
absolutely,
oh, we're going to change that. But there's awesome physicians, and it's just changing.
It is. I think we're going to see. I think we're on the horizon, and I think I commend you because I think with you adding this wellness piece into your med spa, I think it's genius because I think we are headed towards more of a wellness approach.
Yeah,
which we should be.
Yeah.
That's where we need to be because it's let's be proactive versus reactive, and we can save ourselves so much heartache, time, and money.
Yeah, I mean, we're definitely in it for the person. We're a business as well, but that's nurse practitioners and nurses and doctors are notoriously bad salespeople.
Absolutely, and bad business people, quite frankly. I mean,
it's because there's this conflict.
Yes.
We really always want to do what's right for the patient. So,
a servant's heart.
Absolutely. And so that's really what we're about. And that's how we're going to handle the individual person that comes in. So
that's great.
Yeah.
So let me ask you this: for our listeners out there that have been on the fence about a GLP-1, they've got some weight to lose, or they know they probably got some visceral fat they want to get rid of. What myths what fears would you like to get rid of for them, dispel maybe?
Yeah.
And then on the flip side of that question, what would you encourage them to look for in a practice or a practitioner when they're seeking out a GLP-1?
So there's a myth that bugs me. Everyone heard about the woman whose stomach never got restarted again.
Oh.
In like Australia. And you hear about this one person. Here's the thing. No one ever tells you if these people have diabetes to begin with, because diabetes slows down the GI system just from the jump. And so that is just part of that process. So I think that's one of the misinformation things going on. I have people who are on these medications, for almost 2 years, they come off of it or get on a maintenance, their GI system works just fine.
Okay.
That's great. I have not seen one person's GI system not start back up. As a matter of fact, it almost starts up better.
Interesting.
Because
it's like a reset, maybe.
It's almost like a reset. Here's my theory. Because we have a lot of bad bacteria in our guts when we have too much weight or too much processed food or eating too much sugar. So we're populating our gut with this certain kind of bacteria. When you can't eat those foods because sugar makes you sick and you're not eating as much fat, and calories, your gut bacteria changes a lot. There's actually some people actually get that painful die-off.
Oh, wow.
In like the third month. Yeah. And then, they start to repopulate because the food that they're eating is different. It takes a long time though.
Yeah.
Repopulating a gut could take forever. We know
It's a
that.
process.
It's a process. And so it's interesting to actually see that some people have a better GI system.
That's awesome.
Yeah, it's neat.
Yeah.
So I'd like to explain, there's always going to be a case, right, where this happens. I personally haven't seen it. I think we're getting up into the 900 plus amount of patients from when we started. So,
Which is a lot.
I haven't seen one.
That's a good sample size. That's not
a great sample size.
It's not small.
I really haven't seen one. So I'd say expel that myth,
Yeah.
I'm a big fan of getting cleared by your primary care doctor. We are not primary care physicians. I like to be partnered with them.
Yeah.
We don't want to operate as your primary care. We want to be partners with them.
Yeah.
So getting approved, ask your doctors, please. We're all about it. Bring us your lab. Show us. My favorite is when they go back to their doctor who has approved them and all the labs and the doctor's like, oh my
What are you doing?
gosh, like, what are you doing? Please keep doing what you're doing. That's like my favorite. So no secrecy. So I don't like that. And you are in charge of your own health. And if your doctor doesn't agree with that choice, then listen, is it for medical reasons that you shouldn't be taking it? So number one, or is it just because they're not up to date with the research and they're being biased? And so maybe a new physician is really all you need. And then the long-term complications, I can't find too many of them. Ozempic's been around forever.
Right.
What are we going on? I know we're well past 13 years now. Some people have been getting it for 20, like way back in the research studies. Are you hearing any real long-term complications with these people? No, you're just not. You're hearing, this is better, this is better, this is better, this is better. Ultimately, though, if you're not comfortable, don't do anything.
Right.
There's no need to do something you're not comfortable with.
Absolutely.
So I can tell you from having all these hundreds of people walk in my door, they're loving it. And most people say, why didn't I do this before?
Yeah.
But you need to be ready.
Yeah.
So even with aesthetics procedures, I don't know if I'm ready. I'm like, then you're not doing it. Like, get out of my chair. I'll see you next month. Like, you have to be ready. Otherwise, you're not really consenting.
No, agreed. And I think you should be informed, right?
Absolutely.
And that's the whole premise of this podcast, or my goal with it is there is so much misinformation out there. And so my goal with this podcast is to bring experts like yourself on to where we can get to the truth and the science, so that you can be well informed. And like I say in the beginning of the intro, is be the CEO of your own health.
Yeah.
Take
100%.
ownership. I love this. Dr. Lauren Fitzgerald, the functional medicine doctor I love out of Chicago, she says this. She goes, nobody's coming to save you. Like, it's just not happening.
No.
So you've got to be your own advocate and figure out what's best for you and what you want out of life.
Totally.
And so to your point, if you're not ready, you're not ready. And don't do what you're not ready to do.
And find a practitioner that aligns with your values and your thoughts. There's a lot still a lot of doctors that my clients talk about that are just not a good match for them.
Yeah.
And
it's like dating. I mean, seriously, you're not. I don't know how many rheumatologists I went to before I found one that I truly trusted. Now, thank the Lord, because I did clean up my gut, I don't have to see a rheumatologist.
Yeah.
But I the first couple I saw, I was like, wait, what is happening right now? And they're probably great. There's nothing wrong with them.
Totally.
They weren't for me.
Totally.
So
yeah, there's doctors out there for you that will help align with what you're trying to do. So, because you are the CEO,
and you should
stay. It should be a shared model, not a paternalistic model.
Yes.
And I've always been a huge hater, I guess, on paternalistic medicine. So, yeah,
I love that. So tell us a little bit about Glow Med Spa real quick. So, do you have you said BHRT's coming up. Do you have any specials running right now? Anything that you would like to plug in real quick?
We don't run specials.
You don't need to, probably.
Well,
you give all the good stuff.
We have natural specials. So we have a membership that's 15% off everything. So it's $99 a month that banks in your bank. That's the best deal out there. Absolutely. By the time people show up for their Dysport every 4 months, they're just paid for.
Oh, that is good.
It's huge. So that's really the best thing that we have always. No offense to anyone who runs specials, but I I feel like it cheapens service.
Okay.
You know?
Yeah, sure.
We just offer the best service always, and we already have the lower price range. And we actually dropped our prices on the semaglutide and the tirzepatide because the pharmacy offered us a discount. So we offer.
So you extended it. That's
we
nice.
extended it out. So, you know, we try already.
That's great.
And plastic surgeon offices, no offense, are, but it's their expertise as well.
Right,
And,
sure.
and the bills, they have huge facilities. They're charging upwards of $2 more a unit for Botox. So we haven't, you know, we raised our price once on the Botox, and it's pricey.
Yeah, yeah.
So yeah, we do have kind of built-in discount. So when you have 2 syringes of filler, you the first one's $700, the second one's $600, the third one's $500.
Oh, okay, that's
so
great.
So we kind of have these built-in savings already. And if you get filler on top of a Dysport, you get a 15% discount on the Dysport on the cheaper service. So we already naturally have it built in.
Awesome.
Yeah.
And then is there anything else on the horizon for Glow other than BHRT, which, by the way, is super exciting. I will be your first customer. Like, I know for a fact I need it, and I will be. The reality is, folks, as we age, we're going to lose our hormones. Like, it's just what it is.
Yeah.
Like, and there is absolutely nothing wrong with getting replaced what you're lacking if it makes you healthier.
Yeah, totally. I mean, so I don't know who knows, but I was diagnosed with breast cancer in 2023. I'm like, it's been a journey. But, you know, for me, it's been an easier journey than most. We're going to start the hormones, but I'm very interested in hormone replacement in people after cancer.
Same.
Because can we safely give hormones to people who have recovered from cancer? I think the answer is somewhat yes. You know, with oncologist approval and all that stuff. That's not going to be our initial.
Right.
We're not going to do that initially, but obviously I have a passion for that.
Absolutely.
Because it's my life.
Yeah.
Like, why do I have to have less bone mass, more cardiovascular risk just because I've had cancer? Like, it's like kicking me, I don't know, kicking me again.
Yes.
So, so that will definitely be part of our research.
I'm very excited about that because I do know that is something that I hear being talked about within the functional medicine world as well, is BHRT within cancer survivors.
Absolutely.
And it seems,
and some just won't qualify, and we know that.
Right. Well, and there's some that they just can't.
They just
and
can't.
It's just, that's what it's going to be.
Yeah.
But I think more than not, it's going to end up being, I know for sure there's there's a functional medicine doctor that she will work with breast cancer patients.
Yeah.
So I think that's great.
When I was up in Charlotte learning the pellet training, they were discussing a physician who had a study who actually put a testosterone pellet next to in the breast next to the cancer, and it shrunk it.
Oh, that's incredible.
Isn't that neat?
Yes.
Mind you, like, don't sign me up for that.
I mean, that'd be elaborate.
It shows that there's interest
Yeah.
in helping this population of people, and that will definitely be in our back pocket because obviously, you know, I've been through it and have an interest in it as well. So
Awesome. And you have 3 clinics, correct?
So we have Glow Dripping in Dripping Springs, and then we have Hutto Weight Loss and Med Spa up in Hutto, and then we have a nurse practitioner out there and a nurse, great team. And then we have Kyle Weight Loss and Med Spa that's coming March 10th.
Nice.
And then I'll be out there, and then Brisa Rios will be out there. She's a nurse as well. So, yeah.
And you'll be offering all GLP-1s at all 3 locations?
We will.
Okay.
Yeah, and hormone replacement will come to all 3 as well, probably about the same time. So you have Jen up there, who's a nurse practitioner, getting certified as well and everything. She's already actually done hormone replacement because she worked in an OBGYN clinic.
Perfect.
So, yeah. She does have experience with that. So,
well, and this is nothing against any male that might be listening, but there is something to be said about when it comes to, for me anyway, if I were going to go to someone for a GLP-1 or for hormone replacement, I would feel better working with a female. And the reason is because you understand where I'm at in life.
Yeah.
Right? Like if you're married, you know, men can't relate to those changes that you go through in perimenopausal and menopause. Like they just can't. They don't struggle the same.
They don't. I definitely hear what you're saying, and it'd probably be my preference, honestly. But I have seen some amazing male functional. I really have, and they're good at pellets, and they're. I mean, up in Charlotte there was 3, and they've been in the business from functional medicine for years and years, and they're just so smart. And we got to sit in and watch them with patients. So, I think that's a personal preference again.
Sure.
Like, I think you find. You date them.
Yep. Like you said, yeah. Like
Don't actually date them, but
there's a lid for every butt, as they say.
Don't actually date your provider.
I mean, that tends to be a bad idea. What is it? Don't get your money. Oh no, that's work. I was gonna say, don't get your money where you get your honey.
Yeah, don't. Yeah,
But yeah.
married.
Well,
Well, for us, Jen and I actually worked in the NICU together. We went to the nurse practitioner up in Hutto. We're both doing training together right now. We both worked in the NICU right out of nursing school. Neonatal nurse practitioner, again, like we had those gentle touches.
Little tiny.
Yeah. We put chest tubes in 1-pound babies. We put lines in umbilical cords. So IVs and nothing. So I have pellets and shots.
you're like, hey,
I gotcha. It's nothing.
Yeah.
So, and we're used to that delicate touch. So.
Now, real quick, I want to jump back onto something. I don't know why this made me think of this, but it did. You mentioned a little art at the very beginning that Sculptra and GLP-1s work good together. Did I hear that correctly?
Oh, totally.
Can you please expand on that? That's interesting.
So, again, people are losing fat in their face.
Oh, okay.
And unfortunately, as we age, we lose fat already in our face. Yeah. And Sculptra is a natural collagen builder. So it's actually made for HIV patients because they got really gaunt looking. And so they built this product to help them look more normal and filled out.
I didn't know that. That's interesting.
Yeah, and then they're like, wait a minute. This actually works for aesthetics. And it's huge for weight loss patients because they're losing all those fat pads. So Sculptra will go in there and mimic it. I can mimic bone on Sculptra. The big loss is actually right in here. Sculptra is beautiful. And temple. They lose the fat in their temples. So it's so beautiful for this area.
To round back out the face.
Yeah. And filler kind of has a bad word lately. I don't know why. Like, it's just a balancing tool.
Yeah.
But whatever. It's a wonderful product too, but Sculptra is kind of all the rage.
So it's interesting. And I'll just be transparent here.
Yeah.
I've actually done Sculptra with her, and I love it, by the way. Here's the thing for me with filler.
Yeah.
For whatever reason, my body dissolves it.
Totally.
So anytime I've had filler, it's gone like that.
Mm-hmm. Yeah, that's not Sculptra. So
No, and Sculptra has not.
Yeah.
So far, I don't.
Well,
see
and we're
that
still,
issue.
yeah.
Yep.
So Sculptra is a slow game. It works on inflammation.
I love that.
So yeah, that's how it kind of builds out. And so it takes at least 8 weeks to kind of start to see the results. But I'll tell you, I love Sculptra. Like, big fan. I've been doing it for about 3.5 years, and the amount of filler that I've used outside of small little areas is almost none.
Wow.
Because I just love Sculptra. It brings this nice roundness back to your face. GLP-1s, you lose that roundness.
You lose the roundness everywhere.
Probably, yeah. There are some people that do Sculptra butt lifts. I'm not one of them. I can refer you. Hey, the Sculptra in the butt. To
Like
kind of
right
round
up
it
under
better
the.
out.
Like, where do they put it in the butt?
Yeah,
This is fascinating.
like right underneath the
Like the fold.
the thick tissue. Like here.
Oh,
Like where
so-
you could put Sculptra all over your
Like
butt.
over, but like where your SI, like towards your SI joint, like up that high.
Well, like you're fat.
Oh, just right in the
back.
midst of your
yeah,
butt,
yeah.
right in the middle.
Want a bigger booty, Sculptra. I don't do it. Don't come to me for that. It's also like $5 to $10 grand.
No more Brazilian butt lift, ladies. Just
Some
Sculptra.
Sculptra. Hit me up. I'll refer you. But
That's awesome.
we're not doing that in the clinic.
Yeah, can you imagine? I don't know.
No, I mean, it's good results. I think women are actually liking it.
How many rounds of that do you have to do to actually see a result? No.
Usually one, but you're like 10 vials. I mean, it's a lot. Yeah,
fascinating.
Yeah. That's probably not that painful either.
Well, no, not
yeah,
a lot.
Yeah,
That's a back there. But
well,
I mean, that's a lot of tissue back there.
yeah,
So you're good.
totally, yeah.
It's not like your lips or where
Oh,
it's a lot of
gosh.
nerve endings
Yeah,
that are
yeah.
super sensitive. So yeah, that's awesome.
Yeah, but I mean, the time for Sculptra is like you got to kind of plan the weight loss. You don't want to like use all the weight, look gaunt, and then be like, "Give me Sculptra."
Okay, so you want to plan that while you're taking the GLP-1.
I think so. I always say like when you're about 20 pounds away from your goal,
Okay.
or like even 10 pounds away from your goal, or the second you start to kind of see too much thinning. But some people actually look good when they lose that, the fat in their face. But you'll know, like if you're looking in the mirror and going,
Yep.
I'm looking kind of like thin, it's time.
And that was me. I just had gotten to the point where I was like, I have 0 cheeks left. And I'd done filler in the past. And again, it just dissolved it so quickly. So I was like, well, this is a waste of my money at this point.
Huge, yeah.
And then I just got so tired of it. So I was like, what? I went to Jennifer and I was like, what do I do?
Yeah, Sculptra. And Sculptra is, it's your own natural collagen.
Which was awesome.
So yeah, the cool thing about it is that like they looked at studies 5 years later, it's still there.
Awesome.
So once you build it, it's yours. It's what are you losing along the way that we still have to keep replacing. Because there's actually a point in all of our lives, men later than women, that we don't make collagen anymore.
Right.
Boo.
I know.
Yay for you, men. Bad
Right.
for us.
Oh,
But it's also hormone issues.
Yeah.
So
Well, it's just that whole, that 10-year period of midlife for women. There's so much change that's going on.
Yeah.
But thank goodness we have the incredible tools like you're talking about. BHRT, Sculptra, GLP-1's. I mean, these are huge tools that we can be used. And I think what we can take out of this whole podcast is, this whole episode is, GLP-1s are not as scary as they were initially made out to be.
no.
They're proving to be safer than what they were initially thought. And
Yeah.
I think maybe that was a little bit of, I think it was twofold. I think there was a little bit, and I'm going to be straightforward on this. You don't have to join in on this. But I think there was a little bit of the pharmaceutical companies trying to hold on to a little profit in certain places. Listen, that's just the reality. They do that with everything. And then there was another piece
I
of
don't want
it.
them coming after me, so I'm just gonna.
Yeah, you come after me. But I got a lot to say. Anyway, and then the other thing is, I think there were some fitness professionals that were a little like threatened by it at first. I think they're coming around to it.
Well, until they start showing up at my door.
Right, exactly. But I can remember like when it first started, some of these, I would follow some of these people on Instagram, some of these, even other like faster weight coaches like myself, but they would be on there and they would be saying, oh my gosh, GLP-1s are so bad and you're going to destroy yourself by taking them and you're going to get cancer, and fear mongering.
Yeah.
And I'm like, hold on a minute. That's not fair. And at this point, I didn't know a lot about them either, but I'm always on the side of, hold on a minute. Let's get the facts. Let's look at the science first. Totally. Let's not just assume something. Let's look at the science. What is the science telling us? Again, I knew these had been around for over a decade.
Yeah.
So if they were that dangerous, we would have known something, right? Yeah. So I want people to be more informed before they just assume.
Yeah, totally.
And so I think what we can take away from this is GLP-1s are not as scary as we thought. They're very beneficial to certain people, and doing it the right way. There's maybe even some promising new applications for it.
Totally. Yeah.
Which is very exciting. And I love the PCOS.
Yeah, these aren't going away. I mean, Big Pharma's trying to take them away from the common person. Fight for that, because they're really trying. It would be devastating for my clients, because it's really changed so many lives.
Absolutely.
Them and I will be heartbroken. They're trying real hard. We'll see how that goes.
Yeah.
But,
and that's typical, right? Because it's the reality is GLP-1s are making people better. Mm-hmm. They are more profitable when we are sick. Mm-hmm. It is that black and white. Yeah. And so yes, just be aware and know, like, do your research, find good providers that are up to date on their research. That's the other thing. Not all providers are alike, and not all providers are into the research like Jennifer is, and do their due diligence and do the extra training. And that's very important when you're looking for a provider. That's
not only that, the pharmacy that the provider uses.
Very true.
Because the pharmacy that I use two different ones. So we have a office supply 503B and a patient-specific 503A, and that matters because being able to get it right away is a 503B. Being able to have it long-term, well, you can have a 503B forever, but having a script is different too. So it's just a little bit different, the laws on that, and us being able to give it. When you walk in the door, we can give it to you because we have the 503,
which is nice.
Yeah,
you're not having to
they don't
wait
have
for
to
it to
wait.
be mailed in.
Yeah, you don't have to wait because we have that the office supply as well. Both of them very reputable pharmacies, which I've seen their studies, the efficacy and the sterility.
Oh, huge.
Huge. So Grand Avenue, who I use a lot of my patient-specific big plug, Olivia. She's my farm rat. Oh, love them. They're so good to me. And they have studied the efficacy of the online medications. I'm not going to name anyone.
Oh, boy.
But the big ones.
Yeah.
And they're about 20 to 50% effective.
Ooh.
Yeah. So and I'll have people that will come to me from different parts of the city, and they'll take my very first dose, and they're like, that is so different. I'm like, oh, like, I don't know what you were getting. I'm sorry. Like, let's back you down.
You should always question if you're getting a medication like this, that it, don't get me wrong, it's serious. Like, you don't need to take it lightly.
No.
But wouldn't you want somebody to actually see you in person and actually understand who you are as the individual?
Yeah.
And not just get something, not just fill something out online and get something shipped to you? And again, how do you know it's truly what it is supposed to be?
Well, we have our telemedicine people too, but we have a very personal relationship with them. They're usually local,
Yeah.
you know, but they're my teachers. They can't come in during the day.
during school.
Yeah, they're in my community.
Well, and that's even different. I'm more talking about, I've seen lately, and I can't think of the name of it, but I've seen this advertised on TV, and it's like, you want a GLP-1? Just jump online, and here you go. And it's like, that can't be that easy. If it's that, anything that comes easy is a little scary, right?
Mm-hmm.
Like, there used to be a saying my parents always told me. Well, they'd say, easy come, easy go. But then also there was something that's like, anything worth having is a little bit of work, right? If it's that easy, you got to question.
Yeah, you question. I mean, I think the good point about having 3 locations is that we can serve everybody around. And even if we are on telemedicine this time with you, like, you can come and see me.
Right.
You know, I'm
But
right there.
even on telemedicine, at least you're face-to-face with another individual.
Yeah.
And you're not just filling out something online.
No. Yeah.
And getting something shipped in from who knows where.
Yep. And we do have our shipments. You know, we have to follow the pharmacy laws on where it can go. But usually the shipments are family members of people that love us.
Yeah.
So, and we'll do telemedicine with them because the relationship is there.
Are there any states, speaking of, are there any states that you cannot do a telemedicine visit with or prescribe to GLP-1?
You can only do, we only do telemeds in Texas.
Okay.
So we don't try to serve that. Yeah. There's definitely very clear laws about that. So,
And that's why I wanted to bring it up, just because if there
it's
are...
really family members, like they'll come in, like they're here to see their family, and now they came to see us, and now, so you have to be careful with that stuff.
Right. And that's pretty standard for any provider. There's the telemedicine laws are pretty strict, which is good.
Yeah.
There's a reason for that, but
I love the increased access, though. I
Yes.
really do.
Very
because
helpful.
honestly, when I go to the doctor, I don't ever go in. If it's something simple, I do telemed. Yeah. I don't want to go.
Especially because you are a practitioner and you're like, I know what's wrong with me. I just need you to tell me that.
Yeah. I'm just being a baby.
Yes.
So I just need something.
Yes.
I don't go to the doctor, really.
No, I love telemedicine too. I think it's a great, it's great for working people. It really is, because it just
If I
helps
could
out so much.
telemed my OB, I would. I love you, Dr. Iqbal, but if I could telemed that,
Can you imagine?
that'd be amazing.
For your annual.
Bring the kid. No, just kidding. Just kidding.
That might classify as certain film we're not supposed to have.
True.
For anybody out there.
Yeah, different laws.
Different country, probably. It's probably reasonable.
We diverge.
Yeah. Well, I really do appreciate you coming in today and taking
it's
time
been
out of your
fun.
busy practice. I know you're busy building right now, so I appreciate it. And I
I guess
really
I'm tired. I'm not sleeping. It's good. All good things.
And I appreciate you educating the listeners on GLP-1s, because again, I think it's important. It is such an amazing tool to have in your toolbox.
Yeah.
And if you need it, I encourage you to go see Jennifer. She's phenomenal. I trust her because I know that she does her research. I know she does extensive training, and that's important to me as a nurse. That's something I always look for in a provider.
Yeah.
But also, just if you're going to go anywhere else, just do your research. Just make sure you understand. And if, like she was saying, if you have a primary care doctor that's not up to speed and doesn't understand all the research behind it, that is okay. But get a second opinion, because these are emerging and there's more and more coming out, and it might just be the thing that can really help you. So,
Yeah, totally.
awesome. Well, thank you so much. I really appreciate you.
And I mean, piggyback off that, we're a no pressure place. So if you show up and you're like, I don't want to, great. I do have We do have on our website that we charge you $49 to come in and see us. We actually don't. So,
No, you're going to get bombarded. No.
I mean, we don't because it's like a 98% conversion, honestly. And I never want someone to do something they don't want to do. And we don't actually charge for it, just so you know.
That's great. That's great. Well, Glow Med Spa, 3 locations, Dripping, Hutto, Kyle. You can, what's your website?
glowmedspadripping.com is, and then huttomedspa.com, and then Kyle weightlossandmedspa.com.
Okay.
So,
and how about social media?
we are in the name, actually. So all of our names. So Glow Med Spa Dripping is our IG. So,
Okay. Yeah. Well, go give her a follow on Instagram, and thank you again.
yeah.
Okay.
Welcome to Wellness Decoded, the podcast where we cut through the noise, debunk the myths, and uncover the truths behind all things health and wellness. With so much information coming at us from so many sources, it's more important than ever to make decisions rooted in facts and backed by science. Together, we will explore the latest research, break down complex hot topics, and give you the tools to become the CEO of your own health. I'm Cecily Crable, and I'm here to help you take charge of your wellness journey, one decoded truth at a time. Let's dive in.